Hello, my name is Samantha, and I'm presenting on behalf of my team at the Duke Institute of Health Innovation, the Duke Department of Dermatology, and the Duke Department of Biostatistics and Bioinformatics. Our presentation is on developing a dermatology clinical decision support tool for providers in Duke primary care. We develop models to assess skin lesions with the aim of detecting malignant lesions earlier and improving access to dermatologic care. Currently, as a result of limited access to dermatology, primary care providers, or PCPs, are the first to see patients' skin lesions. However, PCPs have variable training in dermatology. Therefore, a dermatology clinical decision support tool could help reduce patient wait times, produce more accurate diagnoses, and effectively triage patients who need dermatology referrals. This consort diagram describes the process we took in selecting images to train our models. We created 3 models: a convolutional neural network image data alone model, a logistic regression clinical data alone model, and a convolutional neural network combined image and clinical data model. Images had associated histopathological reports that we used as the ground truth. For skin lesion images that had clinical data, we extracted 69 clinical features to train our clinical data and combine models. We included patient demographics, image features, surgical history, medications, and comorbidities. We also included time-sensitive data, such as number of visits to dermatology and number of times a medication was administered to a patient prior to a given encounter. Our 3 models were trained using image and clinical data from October 2014 to December 2017. The 2 graphs show that the image alone model performed comparatively well to the combined image and clinical data model, with similar AUC and AP. The clinical data alone model performed the worst out of the 3 models. This is encouraging in terms of expanding access to dermatology because it suggests that skin lesions can be accurately diagnosed based on images alone. Since our image alone and combined models were trained on images taken in a dermatology clinic, we wanted to validate our model's performance in the primary care setting. We developed an e-consult workflow with PCPs and dermatology to evaluate our model in a primary care setting, and then once evaluated, we aim to begin running it prospectively in real time. This graphic shows the e-consult workflow in the primary care setting. If a skin lesion is clearly benign, no further treatment is recommended. Otherwise, the patient is referred to dermatology either as an expedited or routine referral. And this graphic shows the e-consult workflow when a lesion is indeterminate or malignant. This graph shows the preliminary results of our Phase 1 implementation of the e-consult workflow from March 25th to June 28th. Our workflow was able to provide 15 patients with an expedited referral to dermatology, while determining that 42 patients did not need such a referral. As we validate our model's performance in the primary care setting and eventually run the model in real time, we hope that our model will continue to appropriately determine which patients need a dermatology referral. Thank you so much for watching our presentation.